All right, we are going live to talk about nervous system regulation post-concussion, and we're running late because we were having such a good conversation right at the building across from us. We're here at UCLA, and if we haven't met, I'm Julie Hirschberg. I'm a neurologic physical therapist, and
Hi, I'm Lauren Keats. I'm a neuropsychologist at Re+active.
And I'm so excited that Lauren is here. We've never gotten to do this together, right? Okay. And so, in fact, we were just talking. We did a talk and discussion at UCLA with the Brain Sport group, which is a group that does pediatric and adult post-concussion and brain injury care. And this is the first time we've done something in person. And talk to people in person, and it was so nice. So we wanted to give some highlights of this talk, and thanks for being here. I know we said we would do it at 5:30. We were supposed to do our talk from 4 to 5, and at 6 o'clock we were just getting down here because we were having such great discussions because this group is phenomenal. So what did we come to talk about? So we've collaborated with this group. They're at UCLA for many years on common patient care with people who have persistent post-concussion symptoms. And what we did tonight was to bring in some case and some evidence to talk about how we approach this as an integrated team, which we're integrated. So it was so nice to do this together as PT and neuropsych, missing our OT and yoga therapy and training colleagues who are part of our teams, of course. But the two of us got to talk about this integrated care model. And we brought in both the assessment and treatment components of each piece of the pie and why an integrated and holistic approach can be so helpful for persistent post-concussion symptoms. If you know, we talk about the pie a lot, but everything from motor control, physical impairments, sensory components, autonomic components, lifestyle, psychosocial, cognition is a really big piece when it comes to concussion as well. So we talked about the pieces of the pie, we shared a case, but we had some really great discussion on nervous system regulation. And this is such a nice component of integrated care, is we can look at nervous system regulation from many different aspects, from a physical aspect, from a lifestyle aspect, from a sensory aspect. But Lauren has really, really great insight and really great activities to do from a nervous system regulation standpoint that she brings from neuropsychology. So I'm so excited for her to share. And I'm going to pass for you.
Okay. So yeah, as a team, we all love the autonomic part of the pie, of course. I think one of my favorite things to do is to talk with people about their understanding of their body and how they're responding to stress. I think stress does not feel good, and it can certainly, because it doesn't feel good, feel dangerous or feel like our body is doing something wrong. Many times when we've had stress for prolonged periods of time, like after a concussion or after the development of physical symptoms, those symptoms are really, really stressful, and they cause changes in our life which add more stress, and the compounding effects of those stress then bleed into our nervous system, and acute stress can then turn into chronic stress. And that's when we start to see nervous system dysregulation. Maybe we'll be stuck in a sense of fight or flight, or be keeping yourself busy all the time and feeling like on the go, have a hard time feeling relaxed or sitting down and enjoying a book that you maybe previously could enjoy. And so understanding, I think, first that these, when your body's experiencing stress and you're experiencing the effects on your heart rate, or like your mouth feels dry, all those different like multi-organ effects of stress, they're really a cue that your body is doing what it's meant to do, and that there's nothing wrong, there's nothing bad with those signals. We just need to learn how to teach our body how to cue into zones that are more relaxing and regulating. And And that's certainly not easy, but something that we constantly do with our clients. And Julie mentioned that we have some interventions that we like to use. As a team, we really love polyvagal theory and looking at different zones of nervous system functioning, from the fight or flight sympathetic system, which might seem very familiar to some of you, our parasympathetic nervous system, which is really the brakes. It helps calm down the sympathetic response, but then sometimes our nervous system puts on the brakes too quickly, and then we go into a freeze response. And so we have these different zones, these 3 different zones, and ultimately what we want to do is we want to increase the time in which we're spent in the parasympathetic mode, or increase the ability to be able to switch from sympathetic to parasympathetic over there. And that can really start with increasing awareness in your body of what zone you're even in. I think we have the habit of keeping ourselves busy and distracting ourselves from internal sensations, especially when they don't feel good. And it's really important that we do cultivate a sense of like checking in with ourselves and figuring out what state we're in. And I was just mentioning to Julie that one of my favorite interventions is called an autonomic alphabet. And what we could do is you go through all of the letters A through Z, and you find words that correspond with those different nervous system states. So those are the parasympathetic state, the state of relaxation, the state of freeze or disconnection. And then we have the state of fight or flight, where we're feeling on edge or too much. And going through all of the different letters of the alphabet really forces us to think creatively and outside the box as to what those states might feel like. And ultimately, those can serve as anchors for us as we're going about our day. When we start to notice maybe like the C, a sense of calm, then we can map that onto like our parasympathetic state. And we start to develop a sense of patterns that are emerging of what kinds of states that we're in more than others. And with that insight, we can really do so much to expand like our window of tolerance. Someone's saying, give examples, please. Can you explain what kind of examples?
Maybe for the like ABCs.
Oh,
like
yeah.
Maybe an example for A or something like that.
Yeah, so an A might be like agitated for a sympathetic state. Really, it looks different for each person. Stress does not feel the same way to every single person, so it just really requires thinking about yourself, what resonates with you. And for some of the harder ones, you can cheat and also look online. I know some clients have done things like for X, done like excited or something like that. So you can get really, really creative there. But really what this is building is a sense of neuroception, the ability to tune into your body, to recognize what nervous system state that you're in. And ultimately, the earlier that you intervene and you give your body what it needs, the better you're going to be able to strengthen your regulation tools and the ability to bounce from different states, to be able to develop the sympathetic arousal that you need to complete a task and to give a presentation, and then to be able to calm down afterwards and enjoy dinner with your family. And so that's what I think of as regulation, is just being able to switch from different states. And I think of it as a skill, something that can be taught and learned, and can grow at any point of time with just some practice and intention there.
So good. Do you see why it's so helpful to have neuropsychology or psychology in general on the team? Like, well, for one, I too, like this person giving an example, I was like, ooh, the ABCs, I haven't done that activity. And it like really made me think, right? So I'm constantly learning from the other folks on our team of different things that then I might bring in to an activity as well. And when we're particularly talking about post-concussion, one of the things Lauren and I, as we were driving up to, we were talking about this like level of arousal that occurs, which this nervous system regulation, you might use those interchangeably, but often after a brain injury or an injury of any type, you're gonna have a higher level of arousal, and that might be that sympathetic state. And some people actually get so much that it actually goes into the freeze state too, right? And so we're talking about how normal that is to occur post-concussion. And then what happens, especially with persistent symptoms, is that it stays dysregulated. And it really, what I have found has been so important is to have all of us on the team looking at that from different angles. So I love having psychology come in and look at these, kind of understanding this neuroception and tuning in to understand what's happening for that person in their body, and how that's affecting like their thoughts and cognition as well, right? And then PT might come in, and we and OT as well might be monitoring heart rate variability. And actually, you'll take that into a session too, right? So we might all be looking at heart rate variability as kind of an objective way to look at nervous system regulation, because it ebbs and flows with sympathetic and parasympathetic input. And then we might use that within activities. So something that's very frequent post-concussion is exercise or activity intolerance. And so we might use heart rate variability and heart rate to gauge where the person is, and then use all of these components, because we can't disentangle them. And this was one thing that I loved about talking to the group today. They said there's one brain, right? We can't really disentangle the neuroception from some of the emotional components, from the cognitive components, from the physical components. And as this person is sharing in the comments, after a brain injury, it can be really challenging to articulate what is happening. And I love that you share that, because it's also not one way that we might do some of these activities, right? So the ABCs of your autonomic responses, right, might actually be really stressful because it's hard to get those words out, right? And so you might use colors, or you might use body movements. We like to bring in a lot of art to activities. So thank you so much for sharing that, because I think sometimes we latch on this might be the treatment that is really helpful. Well, actually, it's so person specific, right, Lauren?
Yeah, and it's hard to understand. And I think what complicates that is what causes some of these autonomic symptoms is different in many cases as to what's maintaining them. And so it really requires a full team to be able to disentangle some of those things and help people make sense of, maybe this started because of the mechanical aspects of a brain injury, but that might not be what's continuing it. What's continuing it might be a giant combination of a bunch of different stuff, like the symptoms being so stressful, or maybe not feeling understood by your healthcare team or family, or lack of support. There could be so many different factors that are then continuing to drive this response. And once we can understand those, and you have an objective people to be able to examine those different things, then we can really start putting some changes into action and start adjusting that autonomic response.
And it's so this will be the last piece with talking about nervous system regulation. And again, what a great comment that you said. I think it was Aaron said, because one of the things that they shared at the end, the last conversation I had was from one of the neurologists, and he said, "Gosh, you put people at the center and you give them so much control." And I was like, "Yes, I do." And he said that is so hard to do in the medical setting. And exactly. And many folks who have chronic symptoms and have experienced post-concussion symptoms persistently have found a real lack of control and autonomy. And part of that, we understand from the medical standpoint, a lot of their mission is a diagnosis, right? our mission, and he fully understood this too. He wasn't saying it was wrong. He was like, wow, you get to do this. You get to have the person at the center. You get to have them drive. You get to have them tell you what's most important to them and have that drive treatment. It's just flipped from the medical model, right? The medical model is a diagnostic model. And the diagnosis is really important, and ruling in and ruling out and testing for POTS and other diagnoses is really important. But when it comes to treatment, yeah, you are the center. And yes, you are driving even how we approach treatment. I had a great interview last week with a wonderful person named Stella, and she said, what treatment needs to be, it needs to mold to the patient, not the patient to treatment. So that's something that I think, Lauren, you do so beautifully, and I heard her talk about today too. We presented a case of a young guy who now is back to college baseball, which is so exciting. But even within a short period, I think it was 6 sessions, really molding to and understanding where he's at, and then kind of both of you progressing together, right? And I think that's one of the beautiful things about integrated care, about like a truly person-centered care, is that you're driving the rehab bus, and we might be helping navigate and give some direction. And that's an important part of nervous system regulation too. It's not, you're going to see cool yoga things and cool breathing things, and there's so many things that you can try, different monitors and feedback and this and that, and one size does not fit all. And so I really want to encourage you as a clinician to keep an open mind, to respond to the person in front of you and to navigate it alongside of them, and to not just have one thing that you might try, but also for the patient too, to not give up on it as a real important component of recovery post-concussion. If you've tried one thing and it didn't work, right? You tried breath work and it made your symptoms worse, or you tried biofeedback and that didn't help, or you tried yoga and it didn't help. There's so many avenues and so many ways. And I think that's one thing I really appreciate about neuropsychology, is actually finding kind of those personal factors maybe that will help direct what could really be helpful for a person. Yeah, you're so welcome, Erin. Erin says, thank you for your passion commitment to helping people heal. That is my passionate commitment, and I know that for Lauren, for our entire team. And honestly, we're here at UCLA. If you're in the LA area, this would be the team I would send anyone to. Just fantastic, and hearts of gold, but truly put caring about the patient and helping them take those steps on recovery. So fortunate to be able to collaborate with them. I was kind of moved to tears by some of their responses and how they assess and approach diagnosis and treatment post-concussion. That was really phenomenal. Really great. But thanks so much for joining us tonight for this special kind of impromptu one after our live session here at UCLA. And Erin, oh my gosh, that's so great. I don't think I recognized your name initially. So thank you, Erin. Thanks so much for being here, and thank you for joining us. And as usual, if you're on our newsletter, we'll send out this video, and once we post this, you can comment newsletter. We'll send you the link to sign up to. And hey, if you're interested in our post-concussion program too, let me know. I'll send you the link to apply to that as well. So, Lauren, thank you for doing this, and bye everyone. We'll see you soon.